Hi everyone, I'm Dr. Michael L. Johnson. Welcome to number 9 in our practice building series. We're going to talk about the metabolic aspects of practice. We're going to talk about why you need to be addressing patients metabolically and neurologically. You need to really up your game in 2012. Otherwise, I guarantee you, you're not going to be here 5 or 7 years from now. Let me tell you why. Insurance isn't playing the game anymore. I mean, I get hundreds of calls each and every month from doctors in and outside of my program. And it's tough out there. I mean, this is why we've lowered our payment and allowing more doctors to get into our program. You can get into our program for as little as $144 a month at our level 1. We offer a money-back guarantee. So let's look at the metabolic side. This is our message board. We have a main forum, a new doctor section, treatment tips, case fees, but there's a section, metabolic testing and treatment. And literally, it's packed with information. There's 5 pages in the metabolic testing and treatment section. Well, we have a metabolic testing and treatment flow chart. There's a dictionary of blood tests explaining everything, male and female, functional range limit. There's blood chemistry. But let's just take a look and we'll get into what we're talking about and why we do what we do. So here's our metabolic testing and treatment flow chart. We talk about layering nutrition, heavy metals, but we talk about what we do in our practice with our metabolic testing and treatment flow chart. And let's just open that up. And when you join the program, you just do exactly what I'm showing you here. This is our metabolic testing and treatment flow chart. And the bottom line is, what we're looking to do with our patients is specific metabolic testing. What are we looking to do? Well, we're looking to do blood work. What type of blood work? A complete metabolic panel. We want to look at their glucose levels. We want to look at their adrenal glands. We want to look at their kidney function. We want to look at their blood work as far as are they anemic or not. I mean, is oxygen getting around the body? We want to look at every aspect we possibly can. Their liver function. So we do a complete metabolic panel, a lipid panel. We do a thyroid panel because that's important. Thyroid drives metabolism. And we finish up with a CBC with autodifferential. You've got to have autodifferential because it breaks down the white blood cells. So that's the blood work that we do. What else do? We do testing from Cyrex Labs, C-Y-R-E-X, Cyrex Labs. What does Cyrex Labs mean? What do they do? Well, they have 3 arrays that we utilize. They're coming up with array number 5. The first array is a saliva array. I don't really use that with my patients. Some of the doctors in the program do. But array number 2 looks at your gut function. Okay? Do you have tight junctions? Okay, do you have dysbiosis? Do you have a problem with your gut function? I mean, that's really what we're looking at here. Do all the intestinal villi working the way that they should? If patients have chronic conditions, I guarantee you they have gut conditions. And there are studies out there that if you have gut problems, you have, guess what? Brain problems. There's a gut-brain connection. So you've got to handle the gut function. Secondly, we look at, are they allergic or are they having a reaction to gluten? That's array number 3. Are they having a reaction to cross-reactive foods? That's array number 4. And then array number 5 is going to get into what part of their body is being attacked by their immune system. But coming back to array number 4, are they sensitive to potato, to rice, to corn, to other grains, to dairy, to coffee? You have to know this if you're going to get your patient population better, if you're going to be the doctor that you were meant to be. It's great. I still adjust all my patients, but I run metabolic testing on everyone. So there's blood work. There's the Cyrex testing. There's an ASI, an adrenal stress index. We're looking at your adrenal glands. Highly and very important. All right? Very important. So the ASI, that's what we're looking at. What else are we looking at? Well, we're looking at something called a 2105 stool microbial. If the patient has gut issues, you want to know what's causing those gut issues. Do they have parasites? Do they have H. pylori? Do they have fungi or mold, yeast? What's going on in their system? And finally, we do something called an organic acid test. I just started doing that this year, but it covers carbohydrate metabolism, it covers B complex, it covers energy markers, it covers neurotransmitters. It's just a great test. Fatty acid metabolism. So you want to look at all of these tests. You want to evaluate your patients on a metabolic level. If you're not doing that, you're in serious trouble. You're not going to get these people better. I don't care if you run a chronic pain practice. You know, if you have a pain-based practice, you have patients in your office right now that have chronic pain, chronic neck pain, chronic back pain, chronic sciatica. They're not getting better. You're pulling your hair out wondering why they're not getting better. Part of it is the metabolic testing and treatment. So, if you'd like to join our group, you can get into our group for as little as $144 a month. That's on level 1. You just go to this website, txchronicpain.com, watch the videos, watch some videos with the other doctors and their video testimonials, fill out your contact information. Once you're in the site, listen to testimonials. There's over 300 doctor testimonials. Download the free report. Look at the 3 different levels. Pick or choose which level you'd like to enter our program at, and fill out the order form, fax it back to us. Folks, listen. We offer a complete money-back guarantee. Nobody else in the profession is doing that. So we want the top 10% of the profession. That's what we're looking at. If you want to be in the top 10% of the profession, that's where we're going as a group. That's why we have this message board. So I look forward to hearing from you in the future.